Hello, I'm Fred Evans. Welcome to Montgomery Week in Review. Our perception of risk varies because of the ways it presents itself, not necessarily because of danger. Dr. Barry Thompson, a medical geneticist, will discuss these very human reactions. The League of Women Voters of the United States will have its national convention in Washington, D.C. in June. Elaine Apter, a member of the League, will explain why the members are continuing to work to increase the participation of voters in our country. Dental services are in short supply for many people in our community. CCI Health and Wellness Services is working to change that. José Luis Diaz from the organization will give us the details. The Latino Advocacy Coalition has been established to provide an organization for Latinos to influence county leaders on issues of importance to their community. Henry Montes, one of the founding members, has the story. How are you?
I'm fine.
Tell us about risk.
Well, in several decades as a genetic counselor, and it's been obvious to me and many of our colleagues that folks have difficulty dealing with risk, simple risk or complex risk. And much of it has to do with the experiences that people have with respect to risk. If I give you a number for a genetic disorder or a birth defect, oftentimes that is a very, very small risk, but it's perceived as being more important than it really is by virtue of your comparison with everyday risks.
You most of the focus on medical risk, is that?
Well, risk in
General, okay.
Let's just take the well-perceived risks of driving your automobile and flying. Everyone's familiar with the fact that flying is far less risky than driving a car under most circumstances. And so some folks have divided risk into an initial immediate response that's kind of intuitive, and then a more reflective portion as the brain considers what it really means and what information I've been given.
How do you feel the media goes, like with the airplane crashes? I mean, they're just blasted over the media as opposed to car accidents and things which are more likely.
Well, I think, to a certain extent, I like to say we've scared ourselves to death. It doesn't make any difference whether we're talking the rare airplane incident or we're talking a criminal activity in Oregon. It's on the news for a week at a time. It's 5 and 6 times a day. It sounds as if that's happening in Montgomery County. It's happening in your neighborhood. It's happening elsewhere. But a recent article has come out that said that maybe the individuals who take drugs that include the painkiller acetaminophen are somehow less empathetic than the population that they studied that didn't. And this is based on 80 subjects amongst the millions and millions of people that take acetaminophen on a daily basis. And it's a subjective test. It obviously has no statistical validity, in my opinion, even though it's an academic endeavor. It's very difficult for the average person who's taking one of the acetaminophen painkillers to be able to use that information to make any sense.
Wow.
Yep.
So we have a skewed perception of risk, right? So what do we do about it?
Well, I think that's the important part. You need to recognize that there's a lot of bad information out there. You go to reliable sources. For example, the current enthusiasm, if we'll call that in the media, for the Zika virus. Go to the Centers for Disease Control and Prevention. Go to your health department, get the information that's reliable information, and then measure it against your own circumstances. Think of the individual who's spraying the entire neighborhood to kill mosquitoes on the rare opportunity that we have a perceived risk with this new situation, paying absolutely no attention to many of the things that are more deadly in the house, such as falls.
Okay.
How much certainty is there to some of these risks being measured? I was wondering, can we really be certain, even with the genetics that we have now, just how certain are we that a person can come down with a given disease,
Well, suffice it to say that we know less about many of the things that we have begun to develop information about than some others. For some specific genetic disorders, there are very definite inheritance risks that are easy for anyone to perceive. With DNA screening and so forth, many times individuals have information presented to them about which none of the five of us knows anything substantive about. So acting on a finite risk, well described and well defined, is one thing. To thrash about rather undirectioned in a fashion for possible risks is a completely different thing.
And there are also different types of risks that counteract each other, as you were
Certainly.
saying with spraying for mosquito. Is the spray, how dangerous is that spray to the human as opposed to the lone mosquito out there?
And they are decisions that we as individuals have to make, but just as you pointed out, what do you do about so many of these things? Well, you develop the best possible information you get, you incorporate it as best you can, and then you make a choice, as you do for anything else in your life. Don't be swayed by what seems to be information that should be reliable that comes from unreliable sources, or hysteria that's generated by media attention to a particular situation.
I'm going to put you on the spot
Yes.
in the few seconds that remain in this section. What are one or two things that a viewer should do in terms of making sure that he or she doesn't overreact to risk factors?
Well,
I don't know if you can.
Obviously, you have to look at the setting in which the risk occurs.
Okay.
For example, if it's a infectious disease that's not ever been seen in the United States, the risk of that individual having that kind of problem is very, very low.
Okay.
At the same time, get the information from reliable sources.
Thank you very much. Very enlightening. Ms. Apter, how are you?
Just great, thank you. Good to be here.
Good to see you. Tell us about the actions of the League of Women Voters. How long has the League been in existence?
Oh, I'm glad you asked.
Oh.
Because in 4 years, and we're gearing up for it, we are going to celebrate our 100th anniversary.
Oh, my
Hey,
goodness.
Because we were formed in 1920 when women got the right to
that's
vote.
exactly right.
And so actually this goes along what we're doing in Washington this year at the National Convention, goes right along with how we got started. And that is, we got started because once women got the vote, the idea was, well, they better know what they're voting for. That's very important. And so that was one of the main goals, was to educate voters.
In terms of the beginning of
In the
League.
beginning in
Yeah.
1920, and we're right there again. In fact, one of the main things we do at convention is to pick what we call our program, what we're going to do for the next 2 years. And many times it's a study, but we just finished study on campaign finance and redistricting.
Oh.
So we have some new positions, and with the national election, one of the things that we are going to do is more advocacy and working on voter turnout, participation, the voter suppression laws that are really coming out in many of the states due to the horror, what they've done to the Voting Rights Act, Congress has done. And so these are the things we're going to work at. And one of the things that Montgomery County is very, very proud of, the League of Women Voters, is they did something this past year for voter turnout, and that was they had a roundtable discussions for civic engagement, and they got together groups from all over the community on roundtables, and they all discussed how they could get their groups to do more voter participation and get the vote out. And Montgomery County is going out for a national award for this from the League of Women Voters. We're up against 3 other counties.
Congratulations.
So we're very
Great.
proud of that. It was a wonderful.
You made a comment off camera about the education of men and solicitation of male voters also. Can you give us a bit about the expanded
Oh, sure. The League of Women Voters is open to both men and women.
Right.
In fact, we have one gentleman on the Montgomery County Board, but we have 3 board members, male board members at the state level. So we are, more and more men are coming in and participating. And I think mainly, 1, we're nonpartisan, but 2, another draw is we are across the board as far as issues go. So we're not just one issue. So we work with health, we work with housing, we work with the environment, along with voter turnout.
How many members does the league have?
I'm not too sure. We have close to 350, 400 at the Montgomery County level. The state convention, of course, there are leagues in all 50 states, the Virgin Islands, Puerto Rico, and we will see them all coming in, because Washington, D.C. is one of the most popular places for a league convention. They do it every 4 years here, because as political junkies, we love Washington, D.C.
Does the league have resources that it can help community groups do get out the vote kind of activities?
Yes. We have this civic engagement group, but you can call the league office and go on our website, and we will do anything we can. Voter registration. We have our voters guide that this afternoon. After this, I'm going to the first meeting for the general election voters guide, which is probably the most valuable tool a voter can have as far as looking at the candidates and what's going on.
So who's going to be running this year in the election in November?
Okay, there's your presidential election, there's a senatorial election, there's a congressional election, and school board. Don't forget the school board.
Yes, indeed.
Yes,
Don't forget the school
don't
board.
forget the
That's
school
right.
board. And you will have information on all that at Vote 411, which is an interactive voter's guide on the website.
Good.
And I'm sure we'll be back talking more about that, and the actual printed voter's guide. And this gives you, what we do is we ask candidates questions about issues, and all the candidates in their own words reply to the same questions.
And you don't take a position on
We
it.
do
You just
never
simply
take
give
a
their.
position on a candidate. We are nonpartisan.
In about the 20 seconds that remains, what's the major message you want to get across?
The major message
10
is
seconds.
that, as I said, the National will be working on voter participation, hopefully going against the voter suppression laws, and do everything we can to get the vote out and get the voters educated.
Thank you
vote.
very much.
And
We will
vote.
take
And vote.
And vote. On that note, we will take a break right now and be right back. Thank you. And we're back. Thank you, all of you, for being here today. And Jose, tell us about services, dental services for our citizens.
Yes, thank you. I'm happy to be back. CCI Health and Wellness incorporates dental services within our delivery of primary care. It is very important that we make that connection. Talking about risks, if one overlooks our own oral hygiene, the health outcomes are going to be not great.
Now, there is a direct link between oral health and overall health, correct?
Absolutely. In fact, we saw it, unfortunately, too closely a couple of years ago when a young person died from having a oral decay untreated.
Wow.
Something that is simple and easy to do. So we have three health centers that have dentistry incorporated into the practice, one not too far from here in Gaithersburg and one in Silver Spring and one in Greenbelt. And what's great about them is that we use top-of-the-line technology and materials. And yes.
And your website is going to be shown
Great.
on the screen.
It's wonderful because that gives you all of the different locations that you can go to. And as a federally qualified health centers, our job is to provide access to anyone and everyone, whether you have insurance whether you have Medicaid or
Oh, is that right?
Medicare,
Okay.
everyone is welcome. And the centers are amazing. One of the things that we do that not many dentist practices do is we see babies. We encourage moms to bring their baby, whether it's when they turn 1 or the first tooth, whichever happens first. And one of the things that is great about that is that the kids grow up accustomed to going to the dentist on a regular basis. It's not a traumatic experience. It's just part of what you do. It's part of the maintenance that we must do in order to be healthy.
One of the things that I work in public health, and one of the things that we always experience is prevention being a most important element that really kind of gets covered up. And I was wondering how the clinics handle that.
So one of the things that all of the delivery of services that we do it under what is called patient-centered medical home. It's a philosophy of care where the patient is at the center of every decision that's made. And we don't just look at the symptoms that the patient is presenting. We look at everything that's around that patient's life. So we try to connect the dots. Is there an issue with transportation? Is there food insecurity? Is there something else happening at work? What is their stress level? So integrating not just the primary care, but also the behavioral health component and the dental component helps us form a much more complete picture of the person and create a treatment plan that's more adequate and therefore preventative.
Well, I'm particularly interested in the fact that you start with a very young child, because has there not been a misperception for years that primary teeth are not of particular importance, dental care is not as important? Totally wrong, but would you speak to the
Absolutely.
ability to
So it's a
prevention?
double prong approach, because when we have the baby at our dental practices, we also have the parents.
Right.
So we're educating the parents about
The
the importance of not just the oral hygiene, but also of nutrition.
Right.
They're also related, and also the routines that you have to start as a family. So it's not just the baby; it's the parents,
Right.
and then we continue on up.
Yeah. Do you also have orthodontal care? Because that's not just for looks. It can be a health issue also.
It is. Fortunately, we don't, but we have very strong connections throughout the communities that allow us to refer people to specialty care. So we don't have that available. But the other issue that we're confronting now is a lot of families are not drinking the tap water. They are buying bottled water, and as you know, the tap water has fluorides that allow us to help the kids prevent cavities.
Interesting.
So we are seeing a little bit of an increase on that, and we are attributing it to that. So we are recommending parents to bring their kids so we can provide that fluoride treatment at least 3 times a year.
That is in about the 20 or 25 seconds that remain. What are the key things you would like to say to parents or to citizens generally in Montgomery County? Advice.
Start bringing the kids as soon as you can. 1 year, they should see a dentist. Our dentist practices are available to everyone, and we take every insurance available and self-pay.
Thank you very much.
Thank you.
Thank you.
Very good.
Henry, how are you?
Yes, sir. Fine. How you doing, Fred?
So tell us about your organization.
Okay. Well, we started there was about 4 or 5 of us got together in the late fall of 2014
Okay.
and realized after the election that, that there was some concern about not really being engaged by by the Latino population in those election activities. And so when we got together, we decided that, maybe what we need to do is rally all the different groups, the Latino groups, and form a coalition that then can be more influential just because it has a lot more representation of the county.
Was that forming the groups mostly to inform Latinos or to get them engaged or both?
Well, it was really more to actually engage with the powers that be in the county.
Gotcha.
The various groups have been doing that from their own perspective, whether it was CASA or Identity or Multicultural Youth Center. But the idea was strength and power in numbers. And so we had a kickoff press conference in April 13th of 2015.
Gotcha.
It took us a while to get together from that fall to
Right.
and so anyway, so that conference, and we had about 150 people, and we decided that what we would do is focus on the education system first. That was kind of low-hanging fruit. The superintendent was leaving, had left. They were selecting the new superintendent. You know, MCPS was going through some changes with regard to organization and so on. So we felt focusing on
Right.
that. The other thing was that there was already put together a Latino Student Achievement Action Group within MCPS. So that's kind of an internal advisory group to this. And we wanted to provide kind of the outside stimulus, you know, for
Pressure,
change.
stimulus. Good word.
And so we had 4 priorities, and I think the LSAG as well found those to be important, even from the internal point of view, dealing with diversity of staff, dealing
Right.
with having cultural and linguistic competence within the organization, dealing with the career readiness and the technical approaches
Right.
to education, as well as reforming the system. When a system changes from 4 or 5% to 30 to 40% of a population, which happened with the Latino students, it's not the same. It has to be different. You can't be doing the work you've been
And
doing
our-
for the last 20 years.
And the approach has to be different.
And Henry, what is your next area of focus?
Well, right now we're still focusing on the education, because a new superintendent just was named. He'll be taking his
Dr.
position.
Jack Smith.
Dr. Jack Smith, July 1, and so we're still going to be working a lot with the educational issues, because also they've gone through a major change in their ESOL program, and they have gotten more money this particular go-round to do some of these. And we were able to be on a colleague and I were able to be on the community advisory group for MCPS budget development. And so we were in the ground floor and trying to help them with some of the thoughts about what's
Has the
going on.
response been positive from
a good
MCPS, for example? I would think that information alone would be something that would be helpful, but what's been the response?
Well, the response has been very good at the senior levels. You know, MCPS, once you get into the running, is a very complex organization.
Yes.
And each school can be somewhat of a fiefdom.
Yes.
And
I
so
don't know what you're talking about.
I know.
Having been a principal.
I just
No.
thought I'd
What?
say that
No,
for
I-
you, Fred. That's for you. But at any rate, so it's a challenge. It's really a challenge to get them to act kind of cohesively about how they work with our Latino students. And we have Latino students that are, you know, IB or
International
AP
baccalaureate.
students and
right.
so on.
Yeah.
Then we have some that are just arrived,
Right.
that are in tremendous trauma
And need.
Yeah.
and need,
Yes.
and so, you know, the population varies so much that's one, and then the cultural issues associated with that are, you know, somewhat not there.
Are there any in-service things for teachers and principals that you're advocating?
Yeah, well, we colleagues
Have
have
about
done
30
that.
seconds. Good. That's a good
Yeah,
final. final
my
question.
colleagues, we've been working on different ways of, as I mentioned, the priority, the cultural and linguistic competence of the staff, and we've talked about, you know, having somebody at the admission of each school. There's a person that kind of people first go
Right.
to, have that
A
person be
liaison.
bilingual,
Yeah.
and so on.
Unfortunately, we're going to have to conclude there.
Okay.
But I really want to thank you for very, very important topics, and I want to thank you all. Thank you, all of you, for joining me this week. And thank you for joining all of us for this week's edition of Montgomery Week in Review. I'm Fred Evans. Please join us next week at the same time. Thank you.